They destroyed it. And when you go to for X-ray, they refer you to somewhere else, which I will not name, for X-ray and then you at a cost, and then you pay. When we have provided everything, I provided 12 dialysis machines for those who have kidney problems, who require dialysis. It was very expensive. They go across to Senegal. It's very expensive, and this is something you have to do every week. And I provided. I told you I wanted as many as the hospital would need. They said they needed 4. I said, no, 4 is not enough. We put additional 4 to make it 8. I sent 4 to the AFPRC hospital. I wanted to send another 4 to Suleiman Junko Hospital. They told me that they don't have the expertise there. Fair enough. Now, you will be shocked to know that out of the 12 that have been provided, only 2 were working. And they give you the impression that these equipments are very expensive. I was shocked when I went to Taiwan and I asked. They told me it costs less than $10,000. I said, what? Dr. Mbo can bear witness. There and then I used all my money and bought that number. And we also bought again. We also bought an oxygen plant, which would have been so not only sufficient, but the Edward Francis Small Teaching Hospital would have been the main supplier of oxygen to all the hospitals and health centers in this country. Guess what? After 1 month, they say that's a problem. The oxygen tanks are nowhere to be found. And what I cannot understand is, you tell me that the equipment has broken down, only to go there and ask for the equipment is nowhere to be found. There was complete mayhem at the hospital, which is unacceptable. It led to the sacking of some ministers. But I think people at the Edward Francis Small Teaching Hospital, they didn't get the message. So I decided to bring it under my purview. But not only that, also to staff it with people that are ready to work. And then when the Syrians came, there was a lot of resistance. And I made it very clear to the Syrians. Don't give me names. I will know those who are behind it. But warn them that if the president decides to send anybody to jail, you cannot intervene, and you should not intervene. Some cooperated. There were a lot of resistance. Can you imagine the hospital's management spending $20,000 for coffee break during a meeting, and just $5,000 to provide something for a patient who is undergoing surgery? They don't have. There was a time that even the testing tubes, they call them, for pregnant women was not even available. You go there, they tell you to refer you to a pharmacy. When you go, you find it there. And before, during the time of Dr. Gassama, I took him to Egypt and another country, and I spoke to the Egyptian minister of, I spoke to the president of Egypt then, President Mubarak, who is a good friend of the Gambia, who is a good friend of mine, irrespective of what position he is in. He said, don't worry, I will send you to the pharmaceutical companies. You visit their facilities, and whatever you agree with them, we will implement that. I told him, no. I will go and check their products, and we will take samples and test them. Give them to the WHO to test and see if they are of WHO standard. And if the answer is affirmative, I don't want to deal with the companies themselves, because if there's a problem, there'll be if there's a problem, if we pay and they fail to deliver, it will be very difficult for us to retrieve our money. So now what we want to do is sign with the Egyptian government, Ministry of Health, all our agreements with the pharmaceutical companies. We sign that agreement with it is government to government. So if a pharmaceutical company misbehaves, you deal with it. He said, whatever you want, that's what I will do. So we signed, and I said, okay, there's a lot of pilfering of drugs. That's one thing I want done. To put in a mark that you know that unless you are told what it is, where it is, you will not know, so that if the medicine is stolen and sent to a pharmacy, Dr. Kasama can go and stand at the pharmacy and say, this is from government company. This was going on, I thought, up to now, only to realize last year that it has been discontinued. And I regret why I didn't send that particular minister to jail instead of, but then you are long gone. Can you imagine? I want a healthy country. And if you have a healthy country, it's a wealthy country. And somebody wants to line his or her pockets at the detriment of sick people, I am not going to tolerate that. So, I was shocked. Now, most of the equipment at the Edward Francis Small Teaching Hospital, as I say, were obsolete. It's okay. Not only will I bring doctors, but I'll also bring biomedical engineers. Guess what? They found brand new machines, equipment that are vital for surgery and other things that can be found in any high-class hospital, lying in a store, gathering dust. And then I got word that they wanted to sell it, but the buyer asked where it was purchased from, and it was told that it was the president who went on from one of his overseas missions. He bought it, and the guy said, do you think I want to go to jail? So the guy refused to buy it. Now, as we speak, we have the biomedical engineers there fixing up this equipment. And I told the Minister of Health to go around and see for himself what is happening elsewhere. If they can misbehave just next door to State House, imagine what they will do in your village, Sintet. He went around and he was shocked with what he has seen. But he decided to warn them. I have no objections to that. But if they fail to heed his warning and the patients continue to die unnecessarily or are not attended to, his head will roll as a minister. If you look at all the ministries, the Ministry of Health has the highest turnover of dismissed ministers. And I'll continue the trend, not only health, but from now, all the ministers, if you don't want to work, go home. Simple and straightforward. This is not a conscript army where you are obliged to serve. So, up to today, what I have found at the Edward Francis Small Teaching Hospital has shocked me. That's the only most negative part of the year. But I'm going to clean it. A bulldozer leaves a lot of things on that. I'm going to use razor wire, detergent. The strongest detergent is what I'm going to use. Use a bulldozer, a grader, and then a compacting machine to make sure that even grass will not grow there. But if you think that that's only for the hospitals, that applies to the entire civil service. All the services of this government. If you think the salary is small, go home. Because I don't think you'll be happy to know that your, your uncle, or your father, or your brother, or your mother, or sister died at the operating table because they couldn't provide enough oxygen. How much does it cost? When we have provided for them a world-class oxygen plant. Even when it came, and the WHO resident then came and saw it, he said, this is a big step forward.